Now, nobody wants to do things that hurt, but I'm here to tell you that labor usually involves some amount of pain. And side note, if you've seen somebody say that they had an absolutely pain-free birth, as someone who's watched thousands of patients give birth, I can count on one hand the number of patients who looked like they really weren't having any pain. And so again, don't compare, but what are some things that can actually make birth more painful? Today, we're going to review some of those and what you can do to make it a little bit better. And before we get going, I just want to remind you guys that my birth class actually handles all of the different pain management options, including IV, natural pain management, or the epidural, so you'll understand the full spectrum of things. I'm going to link it down below for you guys.
Repeat, this is not a drill.
Announcement. The pregnancy nurse is a nurse, but not your nurse. This is informational, not medical advice. Thank you.
The first one is anxiety. Anxiety can add miles to your pain, and it might not be something that you've thought of, but I'm here to tell you that people who walk in unprepared tend to hurt just a lot more than people who feel prepared and more confident. Now, I don't want to tell you that a birth class can eliminate your anxiety. Your delivery day is sort of like a wedding and a major medical event happening all at the same time. Things are going to change after you have this baby. You're not sure exactly what's going to happen, and you may still be a little bit worried about the choices that you may have to make during labor. So it's normal to have a small amount of anxiety, but that is really different if you walk in completely unprepared. And because anxiety is a little bit normal, I think it's so important for everyone to learn some breathing techniques. Honestly, all of pregnancy can be a little bit anxiety, right? What the heck happened with that ligament pain? Why does it feel like I'm getting stabbed? So learning some breathing techniques are so important. But again, getting prepared for the whole thing is the key. Prepared couples birth better. I'm going to link the class that I recommend to get you guys prepared down below. The next one that can actually make birth hurt worse is not having sleep. Now, if you go into labor at home, it is very normal to sort of mentally freak out. Like, it's happening, right? Insert Nemo clip right here. But if you can tell yourself to stop freaking out and see if you can get some rest in early labor, it is going to help you so much. And I was just at Disneyland the other day, and our rule is if we can be sitting, we are going to sit. And I think the same is true of labor. If you can be sleeping, if there's any way, even rest during contractions, it is so smart to try and get some sleep in. Now, that doesn't mean that you just lay there in one position. Of course, you're still incorporating movement, but the more you can add sleep to early labor, if you get IV pain medication or an epidural, getting a nap in at that point can really help. Now, one of my pro tips is to ask your provider if they can give you something for sleep, either when you're in early labor or the night before an induction. Not every provider is going to be open to this, but sleep is so important. I think we ignore the fact that you're super, super nervous, and sleep might not be an option if we can't help your brain to calm down. So even just one pill, and you maybe even just take half of it, or even using like a sleepy time tea, something along those things. Talk with your provider to see what would be best for you, but prioritizing sleep early on in labor can be really important. Because as you can imagine, as you're longer and longer in pain, if you don't have that sleep that has filled up your gas tank, it's just going to get a little bit worse every time. The next one is baby's position. So hopefully baby is head down. That is usually what they're doing if they're going for vaginal delivery. However, baby can be head down but looking out. So this is called OP or occipit. That's the fontanelle. Posterior, meaning they're looking out. Most of the time, we like to see baby looking down, but a lot of times early in labor, they're going to be looking out. And when they do this, that hard part of this baby's head is pushing into your back and your tailbone and can cause what we call back labor. And it can be so annoying because no position change really does it, although I recommend hands and knees. There are things that you can do, which I talk about in the online prenatal class, counter pressure, being on hands and knees, things like that. Again, everybody's different, but baby's position can make labor a little bit more painful. So what you're going to want to do in those situations is use movement to your advantage to try and get baby to do some of the cardinal movements of labor and hopefully switch from looking out to looking back down and hopefully sliding into the birth canal. I think movement is your best option to try and get baby to turn and also trying to manage the pain as good as you can. Again, getting your partner involved to push on that tailbone and that area of your body can be really helpful. You can also ask your nurse, say, I'm having a lot of back labor. What do you think could help? Again, Labor nurses love to MacGyver. They love to help out, but a lot of times they need to be asked what you would like to do so that they can help you achieve your goals. The next one is that being at the hospital can make labor pain worse. Hospitals suck. There, I said it. We come in your room frequently. We have lots of questions. They're just not as comfortable as your own home. So that's a part of why I always recommend staying at home as long as you can before you come into the hospital. Yes, I'm here to say that I do think some of the things we do in the hospital, bright lights, 4 million questions, not the most comfortable beds, can make labor more uncomfortable and can sometimes even stall it out. So when you get into a good, nice, active pattern, before you go into the hospital, it can be really helpful. And again, the less time you spend at the hospital, honestly, the less painful it's going to be. Some of you may have trauma associated with the hospital. You've been there with a sick family member. Some of it just may bring up feelings that this is just far too real. And as a reminder, hospitals just don't promote sleep. It's a 24-hour job, especially in labor and delivery. We're always going to be checking on you. The blood pressure cuff's going to be going off. So you can encourage them to help you promote sleep. Say sleep is really important to me. But that's why I always recommend try and get that sleepy time out of the way before you come into the hospital. And if you're wondering how am I able to do that, in the online prenatal class for couples, we talk a lot about what to do in early labor at home to help labor continue going, and then how to know when to go into the hospital later on. Again, I'll link that class down below, because that part can be really confusing, especially for partners, because they're thinking, we are having our baby at the hospital. I do not need to know any of these skills and techniques, but doing more at home can really help promote a better hospital birth as well. The next one that can make labor feel a little bit more painful is previous surgeries. Now, anywhere on the uterus, that doesn't mean you've had a C-section. You might have had a biopsy on your uterus, but also cervical surgeries. If you've had any surgeries, in the birth canal or the cervix, it can make labor hurt a little bit more. So that isn't really something that we can change, but sometimes just knowing that if you've had a cervical biopsy, sometimes you can have a little bit of extra pain in that area, or it takes a little bit longer for your body to sort of break up that scar tissue in order to help you dilate. It is actually one of the things that makes birth a little bit harder. I have a whole video on that. I'm going to link it down below. If you've had previous surgeries, I think that's a good one to watch. Again, there's not a whole lot that we can do, but just knowing it can really help you kind of know what to expect. The final one is past trauma. If you've had past trauma in the hospital or sexual trauma or anything like that, it can make labor hurt a little bit more, just because we're sweeping up all of those feelings in that area. There's a lot going on in that area, so it can make things a little bit more difficult. I am of the camp that the more you can divulge to your hospital team about how you're feeling, what's making it worse, the more we can help you. And I know that that makes you really vulnerable, but we don't know what's gone on in your past. And the more you can tell us, the better it is. I'm going to tell you, you are not the first person to have told us things like that. And we really just want to help you more. So the more you can tell us about what you're feeling and experiencing, the better we can help you out with. And you may even want to consider some therapy before going into the hospital. They can give you tools and techniques to work through those things so that they don't build onto your already existing pain and you're able to work through them in real time. Birth trauma can be a real thing. It is one of the reasons that I recommend a birth class. Again, the one that I recommend, I'll put down below, but understanding things can help prevent birth trauma, which I love. Now, I have a whole video on why labor feels different to different people. I'm going to link that one down below, but thank you for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.